So, metal and amalgam fillings were really the only option we had for a really long time in dentistry since, the late 1800s. And the reason that they were used was, again, the technology was all we had. So, metal was essentially melted down. So, gold could actually be melted and molded to fit into a cavity preparation. And amalgam is an interesting material where it was shook really, really fast. So it would get soft and then put into a tooth cavity and then it would harden and seal. Nowadays, that's really not done. One of the reasons is it's actually not great for the teeth because over time, those metal restorations, they actually expand and contract at a different rate than our teeth. So we can get cracking. And over time, the edges of those restorations start to pull away from the tooth. So there becomes this open, oftentimes it's microscopic, but other times it's quite apparent where there's a little opening where bacteria can just settle in and make a home. So nowadays, thankfully, in the last 30, 40 years, the technology for enamel and dentin bonding, so the ability to actually chemically bond a ceramic or a composite restoration to a tooth has become extraordinary. So we can essentially bond a tooth colored restoration directly to enamel, which is the hard outer layer of the tooth, and to the inner softer layer of the tooth. So we are essentially rebuilding the lost structure with this biocompatible ceramic or composite material. When I see patients coming in with a whole mouth of old restorations, old metal fillings, metal crowns, porcelain metal bridges, the first thing I'm thinking is that there's a lot going on underneath that we can't see. So the metal, especially on something like an x-ray, unless there's a really big cavity that is going down the root, we can't see through the metal. And it blocks the ability for us to even diagnose small stuff going on. Sometimes we can feel it. So if we feel around the metal and find the opening, then it's clear. But essentially, when you have really old restorations, it's outdated technology, right? So those restorations were glued onto a tooth, 20, 30, 50 plus years ago. And the actual longevity of the cement or the glue that stuck those on there is not as solid as it is. The bonding technology is also very outdated. So the concern anytime I see, a mouth full of these old restorations is just what's going on underneath there that I can't see. Ceramic as a dental material is fascinating. It's biocompatible and it actually has little, essentially, tubules that can connect with the tubules of the enamel or the dentin of the teeth. And we can bond those. So, unlike metal, we can actually bond ceramic directly into the enamel tubules. So, it's stronger. And you can be less reductive with a ceramic. So with metal, it actually needs a specific thickness in order for it to have strength. With ceramic, it can be thinner and thinner because it's bonding directly to the enamel. So oftentimes that means we have to remove less structure and still get this incredible strength with it. Same day CEREC crowns and onlays, inlays, same day CEREC restorations are an incredible technological advance, absolutely. In comparison to what we used to have to do, where you would have to come in, get numbed up, have the tooth treated, redesigned, get a temporary on there. Usually there was a sticky, really nasty impression of the top and bottom that had to be done. Have it sent to the lab. The lab has to do their design, make the crown or the restoration, send it back. During that time, you're wearing a temporary that's made out of this like acrylic-y type material, and it comes out, and then you have to go back in and get it re-cemented. And it often was a inefficient process for sure. And the CEREC technology just brings the lab part into the office. So when a patient comes in for a same day restoration, we still, numb the tooth, do our redesign, but then we take a 3D scan, we design the tooth chair side, and the accuracy is much higher because me, the treating doctor that just did the design on the tooth, is looking at my image and designing the crown to fit exactly there. And then we mill it in the office. So we have this milling machine that actually spins out with these very fancy drills out of a block of ceramic. And then we can bond it in that same day. So a patient is in and out in 90 minutes to 2 hours with their final restoration. If you're sitting at home with a bunch of silver fillings, I definitely recommend just having a dentist take a look. It's not a one size fits all recommendation. Some of those fillings are small and they're still well sealed. And if you have a really low rate of getting cavities, it could last indefinitely. There's not necessarily a lifespan for any restoration. Nothing lasts forever in our bodies or our mouths, but I would say that there's not an expiration date on them. However, if you're starting to see any of those cracks or little crevices around the edges, it's definitely worth considering getting them cleaned out and resealed so you don't have a catastrophic incident where those little cracks propagate and all of a sudden you're on vacation in the Caribbean and on a boat and your tooth cracks in half, which is nobody wants.